The OrthoPAT system represents a new approach to autotransfusion. The practice of autotransfusion greatly benefits patients by reducing their reliance on stored blood. The OrthoPAT system washes and concentrates red blood cells collected from shed blood during and after orthopedic surgery. It's designed specifically to meet the blood salvage needs of orthopedic patients and medical teams. Because patients bleed both during and after surgery, the OrthoPAT system collects and washes red blood cells, both intraoperatively and postoperatively. The OrthoPAT system provides a consistently high hematocrit red cell product, regardless of the volume of red blood cells collected. The system is fully automated and easy to use. Surgical team members, recovery room staff, and floor staff can easily set up and run the system. No specially dedicated operator is needed to monitor its function. For hospital staff who will be using the OrthoPAT system during or after surgery, this tape provides step-by-step instructions for setting up, running, and disconnecting the system. The OrthoPAT system is small and mounts easily onto a standard IV pole. That means a minimal footprint in the OR or by the bedside. And it also means the system can travel easily with the patient, from the operating room to the recovery room and onto the patient floor. The equipment consists of two units, the base unit and the display unit, which are connected to each other by a permanently attached cord. The OrthoPAT system should be mounted onto a standard IV pole so that the top of the base unit is approximately 36 inches from the floor and the display unit is at eye level. Mounting instructions are outlined in the operator's manual. The display unit is the operator interface, allowing you to set up and run the system in a variety of modes and informing you if an error occurs during operation. The keypad consists of intra- and post-operative mode selection keys. The functional keys run, stop, process, and suction, and an alarm mute key. Active functions are also displayed on the screen. The running time displayed begins when the system recognizes that there's fluid in the reservoir, and the total volume of fluid that has been collected is also displayed. The fluid volume displayed is the estimated volume of all the fluid aspirated from the surgical field, including the anticoagulant and the surgical lavage. You should use the number on the screen when calculating estimated blood loss. The single-use autotransfusion set includes the processing set and an intraoperative and postoperative suction set. The processing set includes the dynamic disc, the reservoir, and bags. The same processing set is used intraoperatively and postoperatively. This set is packaged as a sterile fluid path. The OrthoPAT system itself never comes in contact with the patient's blood. The sterile intra-op and post-op suction sets are included and are double wrapped for introduction to the sterile field. To install the set, open the top cover of the base unit and raise the header arm. Remove the retainer ring and place it on your wrist for safekeeping. The retainer ring is not disposable. Then, remove the processing set from the packaging. Leave the protective cover on the dynamic disc in place. Lay the processing set on top of the system with the dynamic disc resting centrally on top of the centrifuge chuck. Slide the side tabs of the reservoir into the channels on the side of the system. Lower the reservoir until the side tabs rest securely in the channels, and the top vacuum port of the reservoir is seated snugly in the corresponding opening on the base unit. Then, remove the protective cover from the dynamic disc. Press the disc securely into the centrifuge chuck by rotating the disc and pressing firmly on the edges while turning. Place the retainer ring around the top of the disc and fit it into the groove above the disc. Start with the small end of the retainer ring and press it into the channel, moving around the edge of the disc until both ends meet but do not overlap. When the disc is in place, snap the stopcocks into the holders. Be sure that the attached tubing is not twisted or crimped. Then, lower the header arm onto the top of the dynamic disc and verify connection to the disc. The disc should spin freely. Close the cover until it clicks shut. Be sure the cover does not pinch the tubing. Place the waste bag and RBC bag onto the appropriate hangers. Again, be sure that the attached tubing is not twisted or crimped and that the labels face out. Place a patient label on the RBC bag. It's a good idea to hang extra RBC and waste bags behind the ones attached to the set, in case they're needed. These bags may be purchased separately and have a sterile fluid path. To establish suction in the OR, attach regulated wall vacuum to the metal port on the back of the system. Close the clamps on the yellow capped ports on top of the reservoir. Be sure the OrthoPAT system is connected to AC power, and then use the power switch on the back to turn the system on. The system will complete its initialization process in less than 30 seconds. This is a system self-check to ensure proper loading of the set and basic function of the OrthoPAT system. The system uses saline to wash the cells during processing. Using the line labeled saline, spike into a 1-liter bag or larger of 0.9% saline for injection and hang it from the IV pole. Use only saline bags, not bottles. Remove the intra-op suction set package and pass the contents into the sterile field. Then, pass the post-operative suction set into the sterile field in preparation for attachment to the wound drain at the end of surgery. The anticoagulant line and yellow-capped end of the aspiration line should be passed back out for connection to the OrthoPAT system. Aseptically attach the yellow-capped end of the aspiration line to one of the paired yellow-capped ports on the reservoir. Close off the roller clamp on the anticoagulant line and spike a bag of anticoagulant to the drip chamber. You may use premixed ACD or CPD or heparin at 30,000 international units per liter of injectable saline. Squeeze and release the drip chamber until anticoagulant is up to the line on the side of the drip chamber. The system starts in the intra-op standby mode. Run enables the suction and processing functions. So to start the system, unclamp the port attached to the aspiration line and press the run button. The American Association of Blood Banks guidelines recommends suction levels of minus 150 millimeters of mercury or less to preserve red cell recovery. Open the roller clamp on the anticoagulant line to allow 30 to 50 cc's of anticoagulant to run into the reservoir. Then, set the anticoagulant drip rate to approximately 1 drop per second. You may increase it as necessary. The OrthoPAT system is now ready to aspirate and process shed blood. Be sure to indicate the start of the collection time on the RBC bag. When the system is in the intra-op mode, the cumulative volume of fluid aspirated from the surgical field to the reservoir is displayed on the screen as a bar graph and as a numerical total. The elapsed time of operation from the time the system recognizes fluid in the reservoir is also displayed. One waste bag, a 1 or 2 liter saline bag, and a 1 liter bag of anticoagulant are generally sufficient for most orthopedic procedures. Depending on the length of the procedure and volume of blood salvaged, multiple red blood cell bags may be needed. When changing any of the bags, disable the process function by pressing the process button. Aseptically change the bag and reinitiate processing. This allows exchange of the bag without interrupting suction to the field. The system will remain in intra-op run until you press a key. For example, as I just mentioned, pressing the process key will disable the blood processing function. You'll see the process indicator light go off. To disable suction, press the suction key. To stop both the active processing cycle and suction, press stop. The system will go into standby mode. The OrthoPAT system's separation chamber is the patented dynamic disc. It's distinctive in that it dynamically changes size while it's spinning to accommodate whatever volume of red blood cells are present in the incoming fluid. No partial bowls are wasted or diluted. And the system's innovative blood separation technology consistently produces washed, packed red cells with hematocrits between 70 and 80%. The OrthoPAT system automatically processes blood whenever there's sufficient volume in the reservoir. It processes up to 2 liters of fluid per hour. Any deviation from the expected process operation will generate an error signal and error display. The system keeps a small amount of fluid in the reservoir to facilitate the filtration process. To process all the blood in the reservoir, double press the process key. When processing is finished, the system will return to the previous functional status. The decision to transfuse processed red blood cells is made by the physician responsible for patient care. To transfuse salvage cells, remove the RBC bag from the system and then transfuse the blood according to AABB guidelines. Because the RBC bag may contain a small amount of air, do not pressure reinfuse. Reinfuse the cells by gravity only. In addition, we recommend using a microaggregate filter. Be sure to disable process before changing the RBC bag. Pressing stop will also turn off processing, but it will disable suction as well. Pressing process will disable only the processing function. Remove the RBC bag using aseptic technique. First, close the slide clamp on the line between the disc and the bag. Then, twist open the lure connection between the bag and the disc and remove the bag. Remove the protective cover from the lure cap and cap the removed bag. Attach the replacement RBC bag and hang it with its label out on the bag posts. For convenience, we recommend hanging extra bags on the posts during set installation. Use only a Transfusion Technologies replacement RBC bag. And remember to label the bags with the patient label and note the start of the collection time. AABB guidelines recommend reinfusion within 6 hours of collection start time. Once the new bag is in place, return the OrthoPAT system to the run mode. If drains are placed in the wound at the end of surgery, they may be connected to the post-op suction set to continue to collect and wash red blood cells. The system should be transitioned into the post-op mode. To transition to the post-op mode at the end of surgery, press the suction key to turn off suction. The system will continue processing, but will discontinue suction to the surgical field. Clamp the intra-op aspiration line and disconnect and discard the associated tubing and anticoagulant. You can use the yellow cap to cover the port. Then press the post-op key. Once the wound has been closed and the wound drains have been connected to the post-op suction set, the yellow tipped end is passed out of the sterile field and aseptically attached to the single reservoir port. Then start post-op suction by pressing the run key and unclamping the line. The system generates a constant minus 100 millimeters of mercury suction on the wound drain. As in the intraoperative run mode, the OrthoPAT is completely automated during post-op. Blood is suctioned from the wound drain, and the system automatically processes blood whenever there is sufficient volume in the reservoir. Again, saline is used to wash the cells. It's generally unnecessary to anticoagulate post-operative drainage blood because the coagulation factors have been depleted. Unplug the OrthoPAT system just prior to transport of the patient to recovery. Do not turn off the power switch or the data will be lost. During transport, suction to the wound drain continues, maintained by the system battery. The system does not process blood while on battery power, and the display is dimmed. The battery functions for a half hour after being plugged in for 4 hours. The battery will charge whether or not the system is turned on, as long as it's plugged in. The green light on the back of the system indicates that the system is receiving electricity and is charging. We recommend storing your OrthoPAT systems plugged in. Plug in the OrthoPAT system immediately upon arrival in recovery. The system should resume automatic post-op operation. While it's in post-op mode, the system continues to display the cumulative volume of shed blood collected over time. The collected volume is graphed in half-hour increments. The total post-op volume is tracked in the upper right corner, while the total intra-op volume is displayed in the bottom right corner. Bag changes and reinfusion of red blood cells follow the same procedures as the intra-op mode. The system will stay in the post-op run mode until you press a key to transition to another mode of operation or the system is turned off. Once collection is complete, disconnect the patient from the OrthoPAT system by clamping the reservoir port and disconnecting the post-op suction set. Record the necessary data and then turn off the power switch on the back of the base unit. Open the cover and raise the header arm. Next, close the slide clamps between the disc and the RBC bag and between the disc and the waste bag. Disconnect the lure adapters to the bags and cap them. Take the open lures and connect them so that there is no open tubing. Grip the stopcock and release them by pulling gently upward while pushing on the stopcock holder tab. And starting from the tabbed end of the retainer ring, remove it by pulling it gently toward the center of the disc and up. Remember, the retainer ring is not disposable. Remove the disc from the centrifuge by placing your fingers underneath the T-bar and pulling straight up. To remove the reservoir, slide it upward until the suction connector releases and the side tabs are free of the brackets. Then, remove the bags from the bag posts. Discard all disposable components in a biohazard bag and return the retainer ring into the centrifuge for the next use. Wipe down the OrthoPAT system with a damp cloth and 10% bleach. Do not spray cleaner directly onto the system. Again, we recommend that you store your OrthoPAT system plugged in. For the orthopedic surgical team, auto-transfusion becomes a simple, cost-effective option. The OrthoPAT system is small and portable, fully automated, and easy to use, clean, and store. For the orthopedic surgery patient, collecting red blood cells perioperatively maximizes the total volume salvaged and may reduce the need for donor and preoperatively donated autologous blood. All of the information presented here is detailed in the OrthoPAT Operator's Manual. Before using the system, please review the manual for indications, contraindications, cautions, troubleshooting, system storage, and preventative maintenance. If you'd like to know more about how the OrthoPAT system's dynamic disc separates and washes the red blood cells, a short detailed animation of the process follows on this tape. At the heart of the OrthoPAT system technology is the patented dynamic disc, in which the shed red blood cells are concentrated and washed. The dynamic disc separation chamber consists of a stationary plastic top that attaches the inlet and effluent tubing to a rotating base. The bottom of the disc is an elastic silicone diaphragm. It allows the separation chamber to change size and shape while it is spinning. The dynamic disc is installed into the centrifuge so that it forms an airtight chamber underneath the disc. During the intra-op or post-op processing cycle, the OrthoPAT system automatically performs the following steps. When the system recognizes that there is enough fluid in the reservoir, it opens the inlet valve between the reservoir and disc and creates a vacuum under the disc in the centrifuge. The elastic diaphragm is pulled away from the rigid top, creating suction to the reservoir. Blood is drawn into the slowly spinning disc in 100 milliliter batches. When the disc is full, the inlet valve closes and the centrifuge speed increases to separate the red blood cells from the supernatant. The heavier red cells are moved to the outer edge of the disc by centrifugal force, leaving the supernatant towards the center. Once separation is complete, the centrifuge speed decreases and the effluent valve opens to the waste bag. The supernatant is expressed into the waste bag by pressurizing under the disc. The red cell sensor in the header arm detects when red blood cells start to exit the disc and closes the effluent valve. The concentrated red cells remain in the disc and the system initiates the wash cycle. The inlet valve opens to allow saline to fill the disc. The centrifuge slows to resuspend the red blood cells in saline and then increases its speed to separate the red blood cells from the wash solution. When the cells are concentrated and separation is complete, the centrifuge speed slows, the effluent valve opens, and air pressure is applied under the disc to express the supernatant into the waste bag. This time, when red blood cells are detected by the red cell sensor, the system switches the effluent valve to express the washed packed red cells into the RBC bag. The system is able to wash whatever volume of red blood cells is present in each disc of fluid pulled from the reservoir. If the volume of red cells in the incoming fluid is very low, under 10% hematocrit, the system may concentrate several batches of blood before washing. Regardless of the volume of red blood cells in the shed blood, the OrthoPAT system consistently provides high hematocrit washed red blood cells for transfusion to the patient.